Have you ever wondered how diabetes can affect your daily life? It's a question that holds a lot of weight, as diabetes is a global concern affecting millions of people across the world. It's a condition that knows no boundaries, cutting across age groups, ethnicities, and social strata. There are two main types of diabetes: type 1, where your body doesn't produce enough insulin, and type 2, where your body doesn't use insulin properly. Both types can lead to high blood sugar levels, causing a myriad of health problems if not managed effectively. Living with diabetes is like walking a tightrope. It's more than just a physical burden. Yes, there are the daily routines to follow, the constant monitoring of blood glucose levels, the frequent insulin injections or oral medications, and the careful planning of meals. But the impact goes beyond the physical and seeps into the emotional and social aspects of life. Imagine having to constantly worry about your blood sugar levels, wondering if they're too high or too low. This worry can lead to emotional stress, anxiety, and even depression. It's an emotional roller coaster that never seems to end. And then there's the social impact. Having diabetes can sometimes make you feel different, isolated even. It can make social gatherings challenging, especially when food is involved. You always have to be mindful of what you eat, and sometimes you may feel left out because you can't indulge in the same way others can. But the biggest impact of diabetes may be the way it disrupts lives. It's a silent disruptor, slowly but surely changing the way you live, the way you think, and the way you feel. It's a condition that requires constant attention and management, and if not handled properly, can lead to serious complications such as heart disease, stroke, kidney disease, and even blindness. Diabetes is not just a disease, it's a lifestyle, a daily challenge, and a constant companion. It's a battle that millions of people are fighting every day. And while it can be overwhelming, there is hope. With proper management and the right support, living with diabetes can be manageable. Diabetes, a silent yet significant disruptor of countless lives. But what exactly is diabetes? Great question. Let's dive into the world of our bodies and sugar. The food we eat is broken down into glucose or sugar, which our bodies use for energy. This process is like a well-oiled machine, where the hormone insulin produced by the pancreas acts as a key to open the body's cells and let the glucose in. But in the case of diabetes, this system is out of whack. There are two main types of diabetes. In type 1, the body doesn't produce insulin. It's like having a lock but no key. In type 2, which is more common, the body doesn't use insulin properly. It's like having a rusty key that doesn't work well in the lock. Either way, without insulin doing its job, glucose can't get into the cells and it builds up in the blood. Imagine a crowd of sugar molecules all jostling and pushing, unable to get where they need to go. This results in high blood sugar levels, which can lead to a variety of complications if left unchecked. Think of it like a party where the guests can't get in the house, so they start causing trouble in the yard. They might trample the flowers, knock over the barbecue, or even cause damage to the fence. In the body, high blood sugar can damage the heart, kidneys, eyes, and nerves over time. It's also important to remember that our bodies are more like an ecosystem than a machine. Everything is interconnected. When one part is not functioning as it should, it can throw the whole system off balance. That's why managing diabetes is not just about controlling blood sugar levels, but also about maintaining overall health. Diabetes is a complex condition that affects each person differently. It's not just about eating too much sugar or not exercising enough. It's about how the body processes energy and how this process can go astray. So we see, diabetes is not just about high blood sugar, it's a complex bodily malfunction. As of now, how do we combat this relentless malady? Let's delve into the present world of diabetes treatments. Currently, we have a few main methods of managing diabetes. First up, we have insulin injections. These are essential for people with type 1 diabetes who don't produce insulin naturally. They're also sometimes used by those with type 2 diabetes when other treatments aren't effective enough. Insulin therapy helps to regulate blood sugar levels, but it's not a walk in the park. It requires careful monitoring of blood sugar levels, multiple daily injections, or a continuous infusion through an insulin pump. And let's not forget the potential side effects like low blood sugar and weight gain. Next on our list are oral medications. These drugs do an array of tasks such as helping your body produce more insulin, reducing the amount of glucose your liver produces, or increasing your body's sensitivity to insulin. Yet these medications are not without their drawbacks. They can cause hypoglycemia, weight gain, and other side effects. What's more, they may not be effective in the long term as diabetes progresses. Then we have lifestyle modifications. This is a broad category that includes diet changes, regular exercise, and weight management. These modifications can significantly improve blood sugar control and overall health. However, maintaining these changes can be challenging and requires a high level of commitment. And while they can help manage diabetes, they can't cure it. Lastly, there's bariatric surgery, a treatment option for people with severe obesity and type 2 diabetes. This surgery can lead to significant weight loss and improvement in blood sugar control. But like all surgeries, it carries risks and is usually considered only when other treatments haven't worked. So, as we can see, the current treatments for diabetes are a mixed bag. They can help manage the disease, but they come with their own set of challenges and potential side effects. It's a constant dance of balance, a never-ending adjustment. A constant battle, isn't it? But what if there was a more effective way? Enter the era of the revolutionary diabetic treatment. Isn't it astounding how science and innovation never cease to amaze us? Well, prepare to be amazed once again. Today, we're introducing a new, revolutionary treatment for diabetes that is unlike anything we've seen before. This new method is a game changer. It diverts from the traditional approach of merely managing the symptoms. Instead, it targets the root cause of diabetes, making it a truly revolutionary approach. So, how does it work, you wonder? Let's break it down in the simplest of terms. Diabetes, as we know, is a condition where the body either doesn't produce enough insulin or doesn't use it effectively. This new treatment is designed to stimulate the body's ability to produce and use its own insulin. It's like giving your body a gentle nudge, reminding it of its original function. Imagine a city grid with roads and traffic lights. In a diabetic body, the traffic lights aren't working properly, causing chaos and disruption. This treatment, this revolutionary approach, is like a skilled team of engineers coming in to fix those traffic lights, restoring order and harmony in the city. But don't worry, it's not as complicated as it sounds. The process is actually quite straightforward. The treatment involves a series of injections or medications, depending on the individual's specific condition and needs. These are designed to stimulate specific cells in the pancreas, nudging them to start producing insulin more effectively. The beauty of this treatment is that it's not a one-size-fits-all solution. It's tailored to each individual, considering their unique genetic makeup and lifestyle. This personalized approach ensures that the treatment is as effective as possible, offering a promising outlook for people living with diabetes. This revolutionary treatment is not just another addition to the roster of diabetes management methods, it's a complete paradigm shift, a new way of understanding and treating the condition. A breakthrough in the medical field indeed, but how effective is it, you may ask? How does this groundbreaking treatment measure up in terms of effectiveness? Let's dive into the facts. The efficacy of this revolutionary treatment has been thoroughly researched through extensive clinical trials and studies. Each time the results have been nothing short of impressive. The success rates are noteworthy. In the majority of the trials, a significant decrease in blood sugar levels was observed in the participants. Many of them even managed to maintain these levels in the healthy range, a feat that is often challenging for diabetes patients. But it's not just about the numbers. This treatment has shown to have an edge over the current treatments in more ways than one. For starters, it's non-invasive, meaning no surgery, no needles, and no pain. It also has fewer side effects, making it a safer option for many. The benefits extend beyond the physical. Improvements in the quality of life of the patients have been remarkable. Imagine being able to enjoy your favorite foods again without the constant worry of your sugar levels spiking. This treatment makes it possible. Participants have reported feeling more energetic, more in control of their health, and less burdened by their condition. They have been able to lead more active lives, participate in physical activities they previously couldn't, and overall experience a greater sense of well-being. It's also worth mentioning that this treatment is not a one-size-fits-all solution. It can be tailored to meet the individual needs of the patients. This personalization factor plays a significant role in the success of the treatment, ensuring that each patient gets the care that they need. But perhaps the most profound benefit of this treatment is the hope it brings. For many people living with diabetes, managing their condition feels like a constant uphill battle. This treatment has shown that it doesn't always have to be this way. It has given them hope for a healthier, less restricted life. A beacon of hope for many, this treatment seems promising. But is it for everyone? We'll explore that in the next segment. Stay tuned. Who stands to benefit the most from this revolutionary treatment? You may be asking yourself this very question. Well, let's dive right in and find out. Primarily, this groundbreaking treatment is designed for individuals diagnosed with both type 1 and type 2 diabetes. The goal is to assist these individuals in managing their blood sugar levels more effectively and with less daily disruption. It's about making life a little easier, a little more normal, while still ensuring health and well-being. But it's not just for those already living with diabetes. This treatment could also be a game changer for those deemed at high risk of developing the disease. You know, those with a family history of diabetes, those who are overweight, or those who lead a sedentary lifestyle. By intervening early, we may be able to delay the onset of diabetes or even prevent it altogether. Now it's important to note that this treatment isn't a one-size-fits-all solution. Like any medical intervention, it has its limitations. For example, individuals with certain medical conditions or allergies may not be suitable candidates. It's also worth mentioning that this treatment may not completely eliminate the need for a healthy lifestyle. A balanced diet and regular exercise will still play a crucial role in managing diabetes. As for side effects, they're minimal. Most people experience none at all. However, a small number of individuals may experience minor reactions, such as nausea or dizziness. These are typically short-lived and far less disruptive than the complications often associated with uncontrolled diabetes. So, who stands to benefit? In short, anyone living with diabetes or at risk of developing it. This treatment offers an exciting new way to manage the disease, to gain some control, and to live life on your own terms. However, it's always important to consult with your healthcare provider before starting any new treatment. While not a magic bullet, it's a significant stride forward in diabetes management. This revolutionary treatment is here to make a difference, to change lives, and to offer hope for a future where diabetes doesn't have to dictate how you live your life. What does this breakthrough mean for the future of diabetes treatment? This revolutionary treatment has opened our eyes to a future where diabetes is no longer a lifelong struggle, but a manageable condition. Imagine a world where millions of people living with diabetes don't need to constantly monitor their blood sugar levels or fear the consequences of a missed insulin shot. This is not a far-off dream, but a tangible future made possible by this new treatment. This groundbreaking approach has the potential to rewrite the narrative of diabetes care. It's not just about managing symptoms anymore, it's about restoring the body's natural ability to regulate blood sugar. This is a dramatic shift in our approach to diabetes management, and it's paving the way for a future where diabetes is no longer a life sentence. What's more, this revolutionary treatment could potentially change the landscape of healthcare. It's not just about the millions of people who stand to benefit directly from this treatment. The implications are far-reaching. The reduction in healthcare costs associated with diabetes complications could be significant. We're talking about less strain on our healthcare system, fewer hospital admissions, and more resources available for other pressing health issues. The impact on the quality of life for diabetes patients cannot be overstated. This treatment offers hope for a future where diabetes doesn't dictate the terms of their life. It's about giving people the freedom to live without the constant worry and stress that comes with managing this condition. This revolutionary treatment is more than just a medical breakthrough. It's a beacon of hope for millions of people living with diabetes. It's about transforming lives, reshaping the future of healthcare, and paving the way for a world where diabetes is a manageable condition, not a debilitating disease. A game changer, this treatment opens up a new horizon in diabetes care. As we look to the future, we can see a world where the burden of diabetes is significantly reduced thanks to this revolutionary treatment. And that indeed is a future worth striving for. So, where do we stand in the face of this revolutionary treatment? As we've journeyed through the landscape of diabetes and its impact, we've delved into the current treatments and their limitations. We've discovered a new, innovative approach that's changing the game for diabetes management. This revolutionary treatment holds tremendous potential. It's not just about managing symptoms, but transforming lives. It's an opportunity to reclaim control, to live with fewer restrictions, and to enjoy a better quality of life. We've explored the efficacy of this new treatment, the incredible benefits it brings, and the wide range of individuals who can reap these benefits. We've also cast our eyes towards the future, envisioning a world where diabetes is no longer a debilitating condition, but one that can be managed effectively and efficiently. In the battle against diabetes, this innovative treatment offers a potent weapon, a ray of hope for a healthier, happier future.